Hello, my name is Liat, and I'm here to talk to you about a medical condition which is called Bell's palsy, which causes dysfunction of the nerve that innervates the facial muscles. Now, what drew my attention to this medical condition is when a friend of mine the other day, while he was getting ready to go to work, suddenly realized that he has no control over the entire left side of his face. He panicked, of course. He called his wife. The first thing that got to his mind is that, oh my God, I'm having a stroke and I'm only 26 years old. They went to the ER. He underwent brain imaging, MRI, CAT scan, and even was seen by a neurologist. And by the end of the day, he was told that he's having this benign medical condition, which is called Bell's palsy. Now, I'm going to tell you at the end of this talk what happened to him, but my goal for you today is to get you familiarized with this medical condition, and also to understand what are the implications of this condition when it affects a person, on the quality of life of a person that is affected. So I want to divide this talk today to two parts. In the first part, I want to talk about the definition, what is Bell's palsy, some demographics, some clinical features, the diagnosis, the causes. And in the other part, I want to focus more on the treatment options and the outcome and the implications. So let's start with the first one. What is Bell's palsy? So as I said, it's a dysfunction to the nerve, which is called the facial nerve, that innervates the entire muscles of the face. Now, it is believed that there is an inflammatory process that causes that. It causes the nerve to swell, the nerve swelling to the nerve, and this swelling can either lead to damage to the nerve or even death to the neurons, to the nerve cells. Another hypothesis is talking about the reactivation of a sleeping virus, a virus from the herpes virus family, preceded by either trauma, environmental conditions, or even emotional disorders. Now, when you have facial paralysis, there can be several causes. It can be caused by a brain tumor or stroke, like my friend thought that he was having. But when you don't identify a specific cause for that condition, then it is defined as Bell's palsy, which is named after a Scottish anatomist, Charles Bell, that discovered this condition during the 19th century. Now, in the majority of cases, by the way, are Bell's palsy, over 80% of the cases. Now, there can be a partial or a complete paralysis of the muscles on the affected sides. And in most cases, in almost 99% of cases, it will only affect one side of the face, but in rare cases, it can affect both sides. So what happens? So this muscle controls the facial expressions. So the person that has Bell's palsy doesn't have the ability to frown his forehead, blink, close his eyes, flare his nostrils, smile. But moreover, this nerve also innervates and in charge of wetting of the mouth and eye tearing. And also, it innervates the anterior 2/3 part of the tongue and thus causes loss of taste sensation. Now, it is believed that 1 in 65 people will experience this condition during a lifetime, but we know it increases with age. And we also know that there are specific populations, such as pregnant women, that have 3 times higher risk to get this condition than non-pregnant women. And we also know that diabetics are 4 times more likely to have this condition than the general population. So just to conclude this first part, we know that Bell's palsy is a benign condition, some sort of an inflammation to the nerve, and it can affect 1 in 65 persons during a lifetime, and it can cause either a complete or partial paralysis of the affected sides. And now I want to talk about treatment options and the implications. So because it is believed that an inflammatory process is involved, we know that if we start and we initiate anti-inflammatory treatment, basically with steroids, right in the beginning, or as early as possible, we can avoid some of the consequences that can have to this condition, which I will explain in a short while. Some also advocate for the use of antivirals treatment, just because there's this hypothesis that maybe a herpes virus is involved. But basically the main treatment is the steroids. Now, what are the implications? So we talked about the fact that you cannot get any expressions on your face, but the long-term sequels can be even more severe than that. The fact that you cannot tear, you cannot wet your eye, it causes dryness to the exterior surface of the eye, and it can cause eye infections that can lead actually to visual disturbances. It can also lead to chronic loss of taste, and it can also cause something that is called synkinesis in medicine. That means that when a nerve cell dies, it has the ability, the other nerve cells that surround him has the ability to grow, to regrow. Sometimes when they grow back, they don't follow the same path and they go sideways. For example, if the nerve that directly innervates the wetting of the mouth, the salivary glands is damaged, and then it regrows towards the tearing of the eyes. So then we have this condition which is called crocodile tears syndrome, that when a person goes to a restaurant, he starts eating his steak and he starts crying. That is definitely not something that you want to have. So besides that, think about the social implications of this condition. You are in a social communication, we are social human beings, you're in a social environment, and you don't have the ability to use your facial expressions, which is the number one thing that people that communicate with other people look at and interact with you when they interact with you. So the social price can be quite high. Now, I want to assure you that about a little over the 85% of patients will have, of the people affected will have full recovery within 1 year. And you will see this full recovery even within the first 3 weeks, and sometimes even without the initiation of anti-inflammatory treatment. The thing is that if you don't see, the first sparks of the recovery within 3 weeks, probably you're going to end up with some sort of a long-term sequel, and less than 15% of the people will end up with some sort of sequel. So this is something that you want to remember when you experience something like that. You want to initiate treatment as early as possible. So again, just to conclude this topic, so Bell's palsy is a medical benign condition that causes either an incomplete or a complete paralysis of the affected side of the face, either left or right. Rarely it can be both sides. But it is treatable, it can recover even spontaneously, and the important thing to remember is that it's not a stroke, it's a benign condition, and you need to initiate anti-inflammatory treatment with steroids as soon as possible. Now let's go back to my friend. My friend was diagnosed with a Bell's palsy of his left side, and he did have some small sparks of remission within 3 weeks, but probably not enough, because he still has now 2 years after he has this sequel, he still can't fully smile with his left side. His left side is a bit drooped. Left side of the mouth is a bit drooped, and he still uses artificial tears to prevent his eyes from drying up. Thank you.